Yes, thank you guys so much for having me. I'm pleased to be here. So excited to have heard all the other authors talking about the really exciting work they've been doing. A theme that's come up over and over again is this concept of provider burnout and the fact that providers aren't able to dedicate the time they would like to their patients. And patients are getting frustrated as well because the provider often has to spend so much of their time staring at the computer to find information as opposed to having kind of this real life connection with them. At Vanderbilt, we're working on a tool called the Vanderbilt EHR Voice Assistant that's supposed to help with some of the frustration of foraging the EHR for information. It's kind of like an ocean of content, and you're just trying to understand the patient's story and what you're trying to do next to help this person get better. And what's funny is the whole promise of the EHR was to help pull information together to help you gain insights about what was going on, but it's unfortunately stopped a little short of that. And right now, a lot of our EHRs are kind of digital typewriters, and we're feeding the system, giving it data, but there's no real quid pro quo. So what's exciting about voice is that it lets you use a very natural experience and a very natural concept of having a thought and intent. And instead of having to navigate the graphical user interface, which is kind of a rendering of someone else's mind and their conception of where you should travel to get information, you can just ask like you would ask a colleague or a medical student or a resident. And what's neat about medicine is that we're a very dialogue-driven practice. And throughout training, you're asking people for questions and asking people for insights and expecting to get information back. And I think it's well beyond time that we teach our EHRs to help us in that way as well. We're working in collaboration with our dictation provider, natural language provider Nuance, and our EHR vendor, Epic, to scale these efforts and make these opportunities more available to people, even outside of Vanderbilt. So if the link works, I'll be able to show you a demo of the Vanderbilt EHR Voice Assistant. But also, I just want to mention that since we've been working with Nuance and Epic, the Epic Voice Assistant, this is a tool that I consider kind of a cousin to VEVA that's live today. And you can use it to do things like ask for your last note, set reminders, and refill prescriptions, and soon place orders. So this technology is here, it's coming. I think it's been promised for a long time, and I think it's really going to change the way we interact with EHR and even the way we feel about the EHR. Because a lot of the frustration that I hear my providers expressing is that I'm doing all this work to put information in the system and I get nothing back. And by thoughtful design and allowing us to really leverage the natural flow of voice communications, we can really feed back the information back to the providers that they've taken all the time to put into the machine and make their work easier at the end. So Teri, fingers crossed, if this works, would you mind playing the link of the VEVA
yes,
demo?
I'll play the link. All right. Are you seeing that?
Yes, I think the sound isn't coming up as well.
What can you do?
Perfect.
Here's how I can help. Currently, I can give a brief summary of the patient and report their vital signs and some labs. I can also report a patient's medication list and place orders for health maintenance. I will be gaining more skills along the way. Try asking something like, tell me about this patient, or what is her weight?
Tell me about this patient.
Charlotte is a 17-year-old female, noted to have diabetes since 3 years ago, last seen by you 1 week ago for ketoacidosis. Shall I continue?
Yes.
She is scheduled to be seen with you on March 12, 2020. Her latest A1C was 5.2%, measured 1 year ago. The family's preferred language is Spanish. They require an interpreter. You last documented a progress note for her 1 week ago. She was seen in the ED recently.
What problems does she have?
Charlotte's problem list includes anorexia nervosa, type 1 diabetes, hypothyroidism, and seasonal allergies.
What health maintenance does she need?
It looks like Charlotte is due for some diabetes screening labs, including celiac. Everything else appears up to date. You can order them right here. Would you like to order them?
Yes.
I have added your order for celiac that you can sign in the encounter.
Speak faster.
Okay, I'll speak faster.
What is her weight?
Charlotte's latest weight was 47.0 kilograms, measured 1 week ago. Shall I continue?
Yes.
Compared to her previous measurement of 49.0 kilograms from about 8 months prior, that's a decrease of about 2.0 kilograms.
Speak normally.
Sure, I'll speak at a normal speed and volume.
What is her A1C?
Charlotte's latest A1C was 5.2%, measured 1 year ago. That corresponds.
So we can probably pause there,
Okay.
Terry.
Great.
So I cheated a little bit, guys. I just let VEVA do my entire presentation for me. And I know we're short on time, but this is just to say, so this is a prototype that we have that is working in production right now. That was a test patient, Charlotte, but I could pull up the patients I'm about to see this Friday and ask the exact same questions and get the exact same information back. And the benefit of the interaction is that instead of having to go to the specific tab for chart review and then filter out by encounters and then found the last encounter with me and see when she had the last ED visit, I can just ask, because that's what you're doing when you're kind of perusing the EHR to find information. You have a thought in your mind already and you're like, what is the thing? What is my next step? How can I help this patient in their healing process? So we're really excited about the work with VEVA. We're super excited about our collaboration with Nuance and with Epic to kind of bring this to scale so other users and end users can really connect with the EHR in a way they haven't before without having to necessarily navigate the graphical user interface, but just asking for things by voice. And another component from the patient-facing side of things. So it's well enough for your provider to find out what are your labs and, hey, VEVA, refill my prescriptions for my patient. But wouldn't it be great if as a patient yourself, you could say, what are my labs, Alexa? And Alexa, can you refill my albuterol? That's coming too. So we're also working with Epic on coming up with voice assistant interactions for my chart that are Alexa based. And there's so many questions about this. This is what's really exciting about being a researcher in this domain, because there's so much greenfield and so much just unanswered in terms of how should a voice assistant respond back aloud with medical information. It's different when you're talking about the weather or a flight schedule. But when it's your personal information and things about your care and things about how vulnerable you are, we should certainly work to treat this very differently. So these are all things that are in the pike, and happy to have discussions with anyone who wants to talk about this, because I could nerd out about this for years. So please feel free to contact me at any point if you have ideas about how to move forward with this work.
So Ed had a question for you too. Yeah. And do docs like to have stuff read to them, or would they rather just be shown it and read it? Do you have a
that's such a good question. And I don't know if you guys caught the speak faster part, but we specifically built that because one of the feedback we got was, I can read faster than this thing is showing to me. So I think it depends on where you are in your workflow. If you're in a car and you're commuting to work and you just want to get a one-liner about your patients, you probably shouldn't be reading at all. But maybe if you're in your workroom and you're preparing to see the patient, you have the computer screen right there, then you don't have to have it read aloud. And actually, there's a mode where instead of saying, tell me about this patient, you can say, show me information about this patient, and it just shows you the information. So we're trying to make this as versatile as possible to address all the different use cases that exist.